Hello, this is Dr. Laroche. I'm going to talk to you about cataract extraction, affordable excisional goniotomy with a Sinskey hook in Black and Afro-Latino patients with primary glaucoma. These are my disclosures. The enlargement of the lens is the most identifiable cause of glaucoma. Early cataract surgery, lens extraction combined with trabecular bypass should be an initial approach to most people with glaucoma over the age of 50, and this is my approach to glaucoma. Both the lens size and intraocular pressure increases with age. And during accommodation, you get posterior burring of the iris that can rub up against the lens iris complex there and lens iridozonular complex that releases pigment that blocks the drain and trabecular meshwork. And this gets worse as the lens size gets larger. The mean normal intraocular pressure is 15. The mean intraocular pressure in patients untreated glaucoma is 18 and not 21. And people with normal corneal thicknesses, if their pressures are 18 or higher, you really want to do gonioscopy to look at the drain to see if the angle's narrow or closed or open. And oftentimes when it's open, you'll see increased pigmentation in trabecular meshwork. And here you'll see pigmentation superiorly, but more notably, you'll see dramatic more pigmentation inferiorly, indicating pigment liberation. And when you see that, you want to think about taking the lens out in these patients over 50 years of age. Cataract surgery and mixed trabecular bypass is very effective in lowering intraocular pressure and reducing medication burden. This previous study that looked at cost effectiveness of minimally invasive glaucoma surgery found that hook blade was the most cost effective at $495 for single use. However, we wanted to look at the affordability and effectiveness of the Sinskey hook, which is a device that costs about $100 and you can sterilize it and use it again and again. And so the purpose of this study was to determine the real-world efficacy of phacoemulsification, cataract surgery, and goniotomy with the Sinskey hook in patients with primary glaucoma. This is a single-centered retrospective study of predominantly Black and Afro-Latino patients, which make up my practice in Harlem and Southeast Queens and New York City with primary glaucoma who underwent phacoemulsification cataract surgery with goniotomy with an affordable, reusable, straight Sinskey hook. Patients who underwent the above procedure with 3 months follow-up included in the study. And investigated parameters were intraocular pressure, number of medications, visual acuity, and adverse events. And this is a device that we use, a Sinskey hook, 200 micrometer at the tip. And this is a video that shows the technique. You can see the heavily pigmented trabecular meshwork, and I initially used an MVR blade to make an incision through the trabecular meshwork to get to Schlemm's canal. Once I see Schlemm's canal, I go in with the Sinskey hook and I make a pass inside the canal to open that up to the left, and then I make a pass to the right, and you see a nice goniotomy that's there, 200 micrometer in size. And after removing viscoelastic, I place BSS, and you see the blanching of the vessel superiorly, indicating restoration of outflow to the collector channels. And so the baseline age of our patients was 64 years of age. The baseline IOP was 16.46. Ocular hypertensive medications 1.81. Visual acuity was log MAR of 0.41, and the mean deviation of the visual field was minus 9.34. You can see here, 3 months follow-up, the intraocular pressure decreased to 14.43. The ocular hypertensive medications decreased from 1.8 to 0.53, and visual acuity improved to 0.16 log MAR. And these were patients with moderately advanced glaucoma with a mean deviation of the visual field of minus 9.34 dB. You can see here at 3 months, 80% of our patients no longer needed medications, and this worked very well to lower intraocular pressure and get people off medications. One patient had a hyphema, that this was self-limiting and resolved. And so you can see here, these were the results that I just previously discussed. And so, discussion, cataract extraction and Sinskey hook on the expansion of the canal bypasses obstructed trabecular meshwork. The 1.27 drop in medication use in addition to IOP lowering makes the recurrent use of the Sinskey hook goniotomy technique much more cost-effective than a single-use hook dual blade with potentially similar efficacy. Limitations, this was non-randomized, small sample size, limited follow-up. But in conclusion, this study demonstrates the excellent efficacy and safety of cataract surgery and Sinskey goniotomy, reducing the medication burden while maintaining low intraocular pressures in Black and Afro-Latino patients with glaucoma. This is a very affordable option for MIGS both in the United States and throughout the world. This should be considered as initial therapy in patients over 50 with glaucoma with highly skilled surgeons for uncomplicated cataract surgery and angle surgery. Further research is required. Thank you.